好干嘛？你Benny， 你去买了吗 ？Benny， 你去买东西了吗？快点！
那个桌巾有没有办法拆？
啊？
桌巾有没有办法拆？
拆外面的吗？应该，你看一下。嗯？等一下。
不是摄影。这是刚上会的。
对，他没有帮我弄掉。
哦，你有说不要？
我有说不要。
所以
我说我不要橄榄和酸黄瓜。
哎 ，Kenny， 我好奇一件事情，
你上次我在讲，没有。
哎，周宇，你等下闭幕你要讲中文还是英文？我也都可以。
然后，哎，怎样？
他
要不然你讲英文随便。
你讲英文好了，他讲中文。
都可以啊。
我觉得他中文挺好。你觉得这个答案如何
？OK。
中文。哇。
你讲咩跳？你讲跳舞？跳舞，不要讲。
挑动。
我只会什么？我只会听，我不会说。
哎，为什么？
真的。
啊，张外人，就这边。
对。
直播叫什么？
不然你的是什么？
他说玉龙后面是傻的，感觉好可怕。
那你呢？
对，这好专业，所以我的公司就是一直看着看他们有歪掉。你帮我看一下那个现在能不能看 ？YouTube、那个。对。这是什么？叫什么？请问这名字叫什么？金奥。台湾金奥。哦，有哎，好强哦！这是怎样？我觉得有点歪歪的。
有人在看吗？
没有啊，我是唯一一个。
哎，你有那个 link 吗？我觉得他好像要。
你叫台湾金奥。脸书上有。就是这样歪歪的吗？你要看，对，感觉有歪歪的，感觉歪歪的，还是一点点，还好，没事。
那个 YouTube 叫什么？
那就是
2024台湾经济学Olympiad决赛。
就你就打金澳就有。好啊，感觉他是。
就我们假设你这个是中间在这里的话，它也太偏了，需要整个过。
哦，
是要这样吗？
应该是这样比较好。对，
这样
对，这样比较好。OK，
latency。
哦 ，OK， 好，就这样。看我篮球了。
这样。
我觉得其实按铃是最 stressful 的，只有他一点，因为你不小心按错就出去。
谁？
你要按铃。
我就按你很恐怖。
对啊，我上次差点有一个没有按到，因为我对他超抱歉的。
我觉得我这个工作非常的困难。
哦。
要是不小心中到的话就超赛了。
就跟着丢手。
打着。
盯错就完了。
你盯的时候不要压力，因为会没。
哦，好。大人的世界。
对吧？那很客气。
最边边。OK。
冰敷，
这有把冰块包掉，然后放5个小时变成包水。你想？
什么？
这么奇怪
我就
的
知道你很知道。哎，我觉得他们会看会，
他们现在很紧
他
张。
们很紧张。
我觉得他们需要暖暖包吧。那时候怎么办？就说不要冰敷。
超奇怪。
啊？来，真的吗？还好吧。你有看吗？是。我知道，是篮球。
都是球，
我等下
都是圆。
我等下，哎，差很多，一个超大，一个超小。
没有，都是。
火是有其他的生产赛场吗？
对，
会有一点你们就看那后面的人就会听到前面或者哪位说是。
我看因为运气是国际赛，那他因为他们说
对，在后面做比较要有半数的。那问同样问题就觉得，
也不能问同样问题。
考试，国知老师也是得考试的。那国知老师现在是专业，
他上次也
他现在是专业。
专业 BC 评审。
开始了。
开始了。
好，各位选手以及评审以及家长或指导老师午安。我是竞赛的负责人 Joseph。那这边的话，接下来就要开始我们今天最重要的部分，就是要来让我们的选手来进行商业案例的简报。那在这边再提醒一下我们的选手，我们的简报时间总共有8分钟，在7分的时候会响铃1声。在8分钟时间到的时候会响铃2声，此时选手应该要停止发表。那关于问答的部分，我们有5分钟的时间，在4分30秒的时候会响铃1声，在5分钟的时候会响铃2声。那此时呢，选手也必须结束作答。好。那接下来的话呢，在这边跟大家介绍一下我们的这一次的那个评审委员。那首先呢，这边介绍来自东吴大学经济学系的袁国之老师。那接下来呢，是来自国立台湾大学财务金融学系的王衍志老师。那再来是我们汇丰台湾商业银行的资深副总经理Candice Wu。谢谢。那接下来的话呢，我们就要来迎接我们第一组的第一位的这个报告者。那同时呢，在这边提醒一下，我们有附有简报笔，所以呢，在使用的时候呢，你可以自己进行前后页的切换，或者是有这个红色点的功能去指示你的重点。好，那接下来呢，我们就进行第一组的这个简报。
Hello everyone. Today I'm going to make some analysis and suggestions about the Taiwan education industry. So first, starting with to identify the problem. As you can see from these quotes, there's a very severe problem in the Taiwan rural places education industry that there's teacher shortages. And the most important reasons for teacher shortages is that because those teachers want to go to more Eli school because there's more opportunities there, and also because rural areas have less teachers there, so they will have a more workload because they both have to handle the administrative and teaching works. And also because those places are located in more rural areas, there will be some transportation difficulties to achieve the places. And also, there's some misunderstanding in what those rural areas really need. Like, they need companion by those teachers, not just only teach you to how to get high scores in tests. So moving on to more analysis, and first starting with opportunities. Of course, because now there's many education innovations, and because rural schools have a smaller scale, so there will be more flexibility and easier for a transformation compared to those urban schools and more large, which have a larger scale. And also, of course, there will be online learning resources that is accessible for everyone, and it has a more complete system after going through the pandemic time. But there are still some disadvantages about online learning, such as students may not pay as much attention online because there's other temptations, and also online education cannot be customized for those different students, and ignoring those maybe have physical or mental disabilities and have a slower development. So our main goal is to give remote children the opportunity to receive a same quality of education and resources, and also for all kinds of students to thrive by getting more help and with companion. Starting with the short-term strategy, it's called efficient manpower allocation. So special teachers, which is those who will travel around some rural schools to teach each school, they will often have to spend many time in handover and also communicating with the normal teachers about the student situations. So the method is that is a system which is called Rural Students Recording System, and those rural teachers and special teachers will be able to update and record the learning situation of all rural students. And it is an online platform system that is accessible for our teachers, and also you can update at every time, and we will provide the resources to guide those disadvantaged students, because there's many normal teachers who actually don't really know how to deal with those students who cannot follow the normal school process. So the incentive of this method is there will be easier way to find the right antidotes for each student, and also make sure all students will be able to keep on schedule and no one will not able to catch up on the school plan. And the second method is to make good use of education platforms, because there's now already many education platforms such as Taipei Cook, and also other platforms that there's many resources that can be utilized for all subject videos and practices. And the rural schools teachers will be able to develop a fixed semester plan with all the resources well prepared, and so that those teachers who come just temporarily will be able to have access to those teaching plan in a shorter periods of time. So the incentive is that it can decrease the burden in class preparation for the rural teachers, because they already have many works to done with administrative work, and also have to plan some schedule for the students. And also online resources are more interesting, which can help more students to pay attention in what they're really learning. So from this example that I've made, you can see that they will provide the average score of the students, and also give teachers comments, and you can contact with these teachers when you really have problems dealing with the children. And the advantage overall is to solve the teacher shortages, because you'll be able to spend less time in communicating and handover, and also improve the learning environment of the students to customize different schedule and plan for everyone. And the long-term strategy is called One System Entire Education. For now, there's too much and too complex policy in assisting rural education. And if there is a simple system that can support the entire education, it will greatly increase efficiency and also attractions for those teachers who really use these resources. So the first method is to abandon the subsidy for teachers from other places. For now, there's many subsidy like in your transportation or how much you'll receive if you become a rural teacher, but actually these teachers won't stay for a long time because they want to search for a better opportunity. But if you choose native people to be the teacher, they will be able to provide more companion and really accompany children's growth as they learn. So the incentive for abandoning the subsidy is that it can decrease the turnover rate of teacher, and also parents will trust the school more because they really understand what the students need and what each student's situation is. And the second method is to have one single complete education platforms that expand to the entire country. For now, there's like Taipei Cook that is available for Taipei students, but there's not that is accessible for the entire country. And there's also some AI technology that can help in learning. And also, our resources are shared on the same platform, which means that everyone has the same resources, and this reduces the urban-rural gap by receiving like everyone can have access to the same thing. And so, it also can include information of the rural students, like the short-term strategy that I have mentioned before, which is all on the same system, easier to understand. So moving on to risk and mitigation. So maybe there's some parents that won't agree to online education so much because it actually hurts students' eyes. So for this, we can just provide a education plan where there's 30 minutes of online learning and also 10 minutes for practicing. So the 10 minutes practicing is offline papers that won't hurt students' eyes that much. And there may also be some schools that have already been using online resources, but isn't that effective. For these, we think that training teachers that can use a more effective way and utilizing those resources and also take good care of all students is very important because the right use of technology will really improve the effectiveness of online resources. So this is a timeline, which for short-term strategy will be implemented in 2024 to 2026. And for a long-term strategy, after these are implemented, we'll be able to cancel the subsidies because we still have to nurture the local teachers that are able to teach, that have the ability to teach. Thank you.
Can you emphasize which parts of your presentation are related to the Minister of Digital Affairs? Yeah, the system.
So, developing one single system will definitely need the digital affairs to unite all the education platforms that is available online because for now, there's many platforms, but if there's only one system that can be united together by the digital affairs, then it will be easier to assess for all the students and all the teachers from rural places.
And when did you get the idea of those country-sized school things? Say they have some problems, you provide a solution, and where did you get the idea of why they are facing such problems?
Okay, so I've went through some news about many news have mentioned about that. Actually, they don't really they're not really in a shortage of resources in computer or iPads because those governments have already provided to them. So what they really need is a effective method that can help them to really engage in learning and people that can really teach them how to learn in a more effective way and receive a better education like those people in the urban places.
So what do you think the goal of the education should be? So you can have the problem to be problem solving or learning new knowledge or create a good personality. So which one do you think, and how does your method solve the goal of the education?
So your question is, which part of the goal can I achieve from this method? I think first is that, of course, this method can provide a better learning environment for students to have a better knowledge in all subjects, and also they can have a better because they can have more communication with the teachers, and teachers really understand them. They may know how they finding what they really want in the future, and also you're able to maybe some communication skills and also all kinds of skills that is available for urban students. I think this method is a method that can reach all aspects of what a students really need.
Can you go to the page? And my question would be, you mentioned about the policy to reduce barriers to those things. So could you share more about how to do that?
Okay, so I think the most important, most related to the policies is about the subsidy, because yes, for now there's many those policy that is not really effective and really pushing those teachers to teach in the rural areas. So just simply canceling those subsidy will be able to help those native teachers to really teach in the rural school. Because actually, there's one more thing that I haven't mentioned is that after they really receive the education in the short-term strategy, they will be able to have a better education level in the rural area, and those people who have received a better learning in those places are able to give back to the school and really teach the next generations about what they have received from the original policy.
Hello, dear judges and fellow contestants. My contestant number is 79. Today, I'll be exploring the blueprint for Taiwan's disaster prevention through application assistance and also satellite positioning.
Please restart the timer.
Sorry for that. Okay. Hello, dear judges and fellow contestants. My contestant number is 79, and today I'll be exploring the blueprint for Taiwan's disaster prevention through application assistance and also satellite positioning. So first is my executive summary. I'll be starting off with business analysis on the challenges and advantage of Taiwan's relief system, and then move on to my proposal 1 and creating an application, and then proposal 2 of my satellite positioning system. And lastly, I'll be giving a risk management and also timeline for our plans to success. So first is my business analysis. You want to, as the Ministry of Digital Disaster Prevention, you want to work with NCDR because they are in charge of the current research and development towards these fundings of disaster, and also they provide central guidance to these scenarios. So we want to work with this branch of government in order to complete our proposals. So the challenges that we're facing now is coordination, as we currently don't have good resource allocation, and also we don't have quick enough speed for this relief system. And as for the innovation problems, earthquakes are very common in Taiwan, but we still haven't came up with an innovative solution for the past decades. So if we look at this chart here, it shows Taiwan earthquakes that currently happen, and we can see in these stress areas, we have lots of schools, and it appears in all locations, and it's a great challenge for infrastructure such as schools. And for advantages to solve for these problems, we have established systems which has lots of seismic stations that are distributed in all areas. and there's also citizen awareness of the issue. So we want to utilize this for our proposals. So for our goals to success, we identified the problem here is that there's a lack of coordination and also resource misallocation, while there is no innovative solution being presented. So our aim here is to apply digital technology to prevent and relieve earthquakes. So my first short-term proposal here is to create a direct alert application. The services it provides is that it can provide relief during earthquakes directly, because we have immediate response when people press the emergency button on the application, and it's way more efficient than like trying to call a number. And as for reparations, we can have photo and description uploads here, which they can tell like the government what part of their business is damaged. And there's also a discussion area for people to discuss how much should the cost be for reparations. And we're also going to increase the employees waiting on notice in order to solve this increase of demand. Our app also provides inspection services, because government employees can inspect these damaged areas, and they can tell if the environment is dangerous or not, because after earthquakes, some houses might not be safe to live in, and also we can also inspect how much money we should give for the relief. The benefit of this proposal is that we have increased speed during an emergency scenario, and there's also better allocation of resources, because we can predetermine who we should inspect and also where we should go to. And there's also going to be less backlash from the money sent to these reliefs, because those can be discussed by the citizen. And now moving on to my long-run plan, which is creating a satellite positioning system. As you can see from this graph here, it shows all the stations that are currently using our stressors. But if we look at the geography, you can see that in the middle, it's all mountains for Taiwan. And so the distribution that currently appears is that most of these stations are in the West Coast. And this creates the opportunity here for us to actually put these stations in mountains. And we specifically send 85 sensors on these mountains, because it can help our satellites detect landslides and also to detect ground deformation and stress areas. And this can help us actually prevent earthquakes or like predict when earthquakes will happen. And there's experimentation in areas such as Japan that has proven successful, where we can use these stressors to predict when these earthquakes will happen and where the locations would be. So instead of managing the effects of our earthquakes, we can actually prevent them. So we can lower the casualty rates. And how we're going to do this is through a data management model of satellite positioning. The first step is acquisition. We're going to use our land sensors mainly on the mountains that we added to increase the amount of data we can get, so we can actually predict using the GPS system sent to these satellites. And then we're going to upload them to our low Earth orbit satellites, and there's 3 of them, so they can accurately locate all of the places in Taiwan, so we can know which stress areas that we want to focus on. And then we can distribute our resources after analyzing the data, so that we can send officials or send firefighters in order to areas that might have most damage. And lastly, is our government strategy by helping these stress areas and also collecting more data in the future. So the cost of this would be fixed at about 7.4 million USD for sending 3 satellites to space, and also hiring employees to develop the system. And the variable cost would be about 5.55 million USD per year. And it includes the cost for management of data. So now on to my risk management and potential issues and solutions. So the first one being the lack of technology. But we can solve this because there already exists technologies in Japan for these satellite monitoring systems. And there's also countless experimentation that is going on. And our data can be improved in the future once we have used the system. And the second problem is misallocation, because as we know, we had a website that had an emergency button. So people might press the button, which can cause misallocation of resources. So how we're going to solve this is by using huge fines for people who misuse websites. And then we're going to use our direct assessments, because using government inspection, so that we can know if we should allocate resources to those areas. And lastly is construction delay. So we're gonna solve this because our government funding can directly tell which areas require the most funding, and then the suppliers will have to make demands because they want to comply to the government. So lastly, it's our integrated timeline and conclusion. So first, we're going to implement our website by directly providing services to the citizens, and then we'll be sending our satellites to space. It'll take about 2 years to plan. And then we'll focus on optimization by improving more of our ground sensors and also implementing those data to predict earthquakes. So for my conclusion, our future is very bright, and we have a good plan ahead of us where we can have good coordination with fast response and also good resource allocation. We'll also have a good prediction systems where we want to lower the casualties down to 0. And we also will have fast relief to help unsafe citizens and also increase the welfare for disasters for our entire country. Thank you.
To make sure your digital solutions are available for the general public, especially for the elder or the low income.
So for our application, it's obviously free to download because it's given by the government, so everyone will have access to this. And this actually helps the elders or like people who like don't have some disability because now they don't have to like get up and call. They can just like press a button on your phone in order to use this website. And for this second proposal here, the government will distribute this data to like different areas so that they can like aware different citizens. So all people will be included in the plan.
Why you assume everyone, at least the elder, they all have their mobile device? If I don't have a mobile device, I can't receive any information from the government, right?
Like right now, there's already like, for example, sirens or even like TV broadcasting news of our earthquakes. So with our satellite positioning model, we're actually able to predict that. So then for people who don't have access to like mobile phones, those will be on like broadcasts or on TV where they have more access to them because now we can predict. So then they won't be able to like they won't have shock when the earthquake immediately happens.
2 questions. The first one, the right now looking at the page 7. So how do you estimate the cost for Singapore for $4 million and the airport? How do you get that?
So for our satellites, we use low Earth orbit satellites, which Taiwan currently already have those technologies, and they would each cost about 500,000. And we have 3, so we can have like direct locations, which is about 1.5 million. We're gonna hire 30 engineers for this kind of 2 years to develop this, which would cost 4.2 million.
So on the process, so don't you need the technology
That would
need to pay the licensing fee, right?
This technology is already somewhat open source. So if we can use like our digital ministry to negotiate with people who already have these technologies, maybe
So you say this technology is
yeah.
So what's
This technology is currently in experimentation for this process, but we know that it's somewhat in development. And because Taiwan is such an area with frequent earthquakes, we can like work with people who have this technology and use Taiwan as an area for data collection and to see if we can actually like predict these earthquakes.
I know what to put you. So say you try to prevent the earthquake. How can we prevent? Even you can forecast how to stop the earthquake.
We don't prevent the earthquakes.
Say you prevent, right?
When I mean by we prevent, I mean the effects when it comes to managing like earthquake reliefs. We can prevent casualties
So
from
your
happening.
first page. Yeah, the next one. The next one. Yeah, the Taiwan earthquake prevention. The title.
Oh, okay, then I guess that's an interpretation issue, but what we're trying to do is that we want to be able to lower our casualties by awareing our citizens.
You mentioned about kind of so-called pattern control. misallocation. So can you say that one, how to improve?
You mean resource misallocation?
Yes.
Okay, so like one issue that might appear with our proposal is that people might like want to force too much like relief from the government, or they might like press the button when they don't actually need it. So how we're going to do this is by using huge fines to prevent that from happening. And also, if we can use this website and collect more data, we can know like which people that we need to help in which areas require like the most stress relief.
Yes, my question would be, instead using the huge fines, how about encouragement? How to reward prevent the misallocation?
Oh, okay. So I think the reward here is simply the use of the relief system, because if they can provide adequate like photos and also descriptions of the damages that were brought to them by the earthquakes, we'll actually provide adequate funding through our direct response system. So then they can get those reliefs, whereas before it'll take a long process to get that.
Okay, and Council about the timeline as well. So you mentioned till 2027, and how about the rest of the years? Because I thought we will have the long-term plan for 2025. Okay.
说，
他不是我拿那个回来去，
对啊，
那个那个刁难他。
Okay, so hello, dear judges and dear contestants. So the topic I'm going to focus on to discuss today is going to be the healthcare aspect of the Ministry of so today we're going to focus on the healthcare aspect, and the solution I came up with is through telemedicine. And telemedicine is basically like an online system where like people can use it to basically through online system you can meet up with their doctors. Okay, so first let's start by introducing the market and introducing like the current status quo. So from the first graph, you can see like the difference between medical resources between major cities and also between like rural areas. So there's like a wide range of difference between like the quality of the hospital that are available for these areas. And also for the second graph, you can see like the first up is the medical resource available for each areas. And as you can see, there's still a clear difference between different areas with like major cities and with like rural areas. Also, there's like a lack of human resources with the rural areas. So as you can see from this graph, there's a clear difference between like, for example, such as Lianjiang and Jingmen. So these two rural areas have a clear difference and a clear disadvantage compared to other areas in Taiwan, which leads to and also the second aspect is like the distance issue. So as you can see from this graph, so the distance of hospital with like their home difference between varies between different areas of Taiwan. With like as you can see from the East Coast, they have hard access to like the medical resources with like hospitals, which you can see from the graph. So with long distance, it will lead to difficult transportation, and with difficult transportation, it will lead to a lack of resource. And by lack of resource, I mean like the lack of resource where it's harder for resources to be transported to like the local hospital to these areas due to like a landscape difference. And there will also be a difficult of a human resource available with this area, because these areas basically people will be less likely to go to these areas to like work for them. Therefore, so to sum up, the problem we're facing right now is the low accessibility of healthcare due to the long distance of traveling. Okay, so So the solution I came up with is telemedicine. And the definition of telemedicine is basically to use technologies to provide and support healthcare. So what we're focusing on will be using the technology to solve this issue, which is what our ministry is trying to which our ministry is trying to solve. So there are 4 aspects I'm going to focus on for telemedicine, with the first aspect being cost saving of telemedicine. So by reducing the need for travel for patient and care providers, we're saving the traveling costs for healthcare, which will lead to even more willingness to participate in healthcare activity, which will lead to basically better healthcare provided and also better healthcare received by our patient and by our care provider. And the second aspect is flexibility. So flexibility, we're basically offering more flexible appointment times and location, because with us having different location of the care provider and also have with the patients, we'll be able to have a more flexible appointment, because they'll be more easily to set up the appointment's time and also the appointment's location with our online system. And the third one is continuity. So through our telemedicine, people can more easily to have access with the medical care, because the standards and the bar for people to access the medical care will be lower with our online system. So by providing this lower bar, people will be more likely to visit their doctor and have a more frequent and regular checkups with their doctor, which ensure the health of the patients long term. And the fourth aspect is the efficiency. So due to us be able to set up appointments online, we'll be able to reduce the waiting times and also to reduce the time we're using for appointments, which is basically saving costs at the same time, because with us saving the time, we'll be able to have more patients and have more care provided for people. Okay, so more specifically, so what is our website going to do? So with the functions, the first aspect will of course be appointments, because we have to set up the meeting first in order to be able to provide the medical care. And second is the online meetups between the doctors and the patients, because the sole purpose of our telemedicine is to provide the medical care that the patients requires. And the third aspect is to have prescription for local pharmacies, because by providing a more specific care and by providing the prescription, patients will be able to take the prescription and go to the local pharmacy to actually take the medicine and the care they need, because we're not able to deliver the medicine through long distance, because that would simply be putting too much stress and having too much money requires and too much cost for our system. And also where does our doctors and where does our human resources came from? So just like the graphs I showed before, there are huge difference between the human resources available with the major cities and also the rural areas. So therefore, we're basically using this system to balance it out and to use the human resources that are kind of extra within the major cities, and to use this telemedicine and to do the online system to let the patients within the rural areas to use the medical resources from the major cities. And also with this system, we're ensuring the quality of the doctors available, because if the rural areas are not able to have access with the good quality of doctors from major cities, they'll likely seek less qualified doctors, which will negatively affect the healthcare they're receiving. So the current number of pharmacies, there's a total of 10,000 stores, and which means that there are enough pharmacy and enough medical resources available for them. And also with internet access, there's 97.4% of people in rural areas which have used cellular data, which compared to a Taiwan average of 97.9% is not much. Therefore, the internet access will not be an issue in terms of the telemedicine system. So with 30% of total population being from rural areas, we predict first year of 20% of the total rural population using our system, and with a growth rate of 5%, will continue to expand. And also with the total cost adding up to 14 million and a growth rate of 5%, which is the same as the growth rate of our current growth rate of the people, our costs will be as shown. So telemedicine basically means more convenience, and with more convenience, we're providing the people with the healthcare they need. Yeah. Thank you, everybody.
Because I think the National Health Service they require people, if you are not, first they want you to go to the local clinic, and they go to the more high level hospital in case you need. So once the telemedicine is applied, everyone can, no matter where you live, you can say, I want to set appointment with National Taiwan University Hospital like that. How did you do something more to prevent these things happen?
So I feel like this is like a part of where Taiwan healthcare system is kind of lacking, because people right now currently we can still make appointments with like the stores. So of course we're gonna require people to pay a certain amount of money for the appointment they're taking, because if the government is completely taking over and completely taking over the pressure of like taking the cost of appointments, then like people can just easily continue to like press the appointments, and they're actually not using the medical resource. So they're just kind of like wasting our system's advantage of like crossing of like long distance traveling, because with like with people taking appointments, we're kind of using the system and like using up our resources, but this is just kind of like what is currently what we're like not able to solve, because people will just because with like this cost, if people are willing to take the cost and like not use the resources, then it's just kind of like their choice. So we can't really prevent, but we can still like cut down the cost because we're still taking the appointment cost, like appointment fee.
Also, I'm not expert in medicine or something, but I think in the medical case they are emergent and not emergent. And how do you think the telemedicine can help which part can help more for the emergent part or the not emergent part?
Oh, actually, I feel like we can have like a improve both parts of it, because with us through online, we'll be able to solve the long distance traveling, the long distance time. We'll be saving the time. So for emergency, we will be able to through online like reservation, will be, or maybe not reservation, we can have like an emergency sector, specifically for emergency purpose. So with us being able to solve the with us being able to save the time of traveling, we'll be able to save the emergency aspect. But also for the non-emergency aspect, we'll also be able to save like the traveling time, also the traveling fee. Because with the online system, it will simply be quicker and more efficient for both the patients and both the care providers.
So the 14 million is for each hospital or the for the whole country?
Well, the $14 million is simply for the total cost of the website. Well, so the reason I have this number is due to like I researched like a number for like a website building and like yeah. So this is a system that will be implemented throughout the hospital in Taiwan.
I don't believe the anyway. Okay, so should we worry about the data breaches issue, because all very controversial data will be uploaded to the system. So what is the hacker attack and issue?
Well, I feel like this will not be like a problem I will be able to like our ministry is able to solve. This may require like further technology improvements and able to like improve the internet security issues. But that is really not like what we're that's
even the Microsoft has been attacked.
Yeah, but that is like a problem where like multiple different companies and multiple different industries is trying to solve as a whole. Therefore, we're predicting like they're having like a technology improvements to able to solve the security issues. So therefore, I feel like this will not be like an aspect we're focusing on for my system, because my system is simply focusing on my system is simply focusing on the convenience aspect. Yes, thank you.
afternoon. Today I'm going to introduce my solution to the education of rural areas. This is my executive summary. For the problems, according to the 2018 PISA exam, Taiwan got a good grade in this exam, but however, behind this good grade, it's a hidden problems behind this good grade. Take a reading session, for example. It reveals that there is a 6 years education gap between the top 10% of students and the last 10% of students. And the last 10% of students, which usually come from the rural areas or some disadvantaged families. Furthermore, this chart is from the Minister of Education. It's about the number of the schools in rural areas. It's about the number of schools in rural areas is 1,106. And the number of schools in Taiwan is 3,307, which means that the schools in rural areas is of